Hi, today we are doing ECG. To start off with, we need to collect the required equipment, which is an ECG machine, the dots to actually connect onto the patient for the electrodes, and also too we might need a razor if required with the chest. First of all, I'd like to acknowledge that I've done the hand hygiene, and I've explained to our patient the procedure on what's going to happen with the connection of the dots and the ECG procedure that the doctor's requested, and we've got consent from the patient. The ECG is going to be a 12-lead ECG, and it has 10 dots, which are attached to 4 limb leads and 6 to the chest leads. So we're going to attach the 6 chest leads. Sometimes our consideration is the adhesion of the dots onto the chest, so we'll have a look and see. And as you can see, we do have a slightly hairy chest here, so we will have to just shave some of those areas. So I hope you're okay with that. Okay, great. And so we'll just look at the area and shave. Now that we've have the area prepared for the dot placement, we now need to work out the actual location. So the location is starting with the countdown at the clavicle, and we go down to the 4th intercostal space, so 1, 2, which is here, 4th intercostal space, and we're going right and left sternum border. And all I'm going to do now is just place the dot on either side. Like so. Now that's V1 and V2. We're now going to go to V4, which is going to be mid-clavicle, okay, going down, but it goes into the 5th intercostal space, which will be here. Now the next one will be the V6, and it's going to follow around, and it's going to go mid-axillary, and then we've just got 2 more to place, which is going to be V3, which is still remaining in the intercostal space of V4, and the remaining one goes like so. Now for the limb placements. So for the limb placements, we're going to go on our arms. We're going right and left arms. And then we've got it down onto the legs here. We're making sure that we are attaching them symmetrically, so I've got it up here on the arms and on the legs, or I could have done it as the trunk, and I could have put the arm ones from here and the leg ones there, should I choose to, but in this case we'll do it this way. So now what I need to do is attach the leads, and you'll find you got right arm and right leg. And all I'm going to do is now just clip them on. Left leg. They're all clearly identifiable, so it's quite easy to work out what ones that you're going to put on. And then we've got all these ones here, and we want to make sure that we're getting them all into the correct numbering. They do get a little bit tangled up at times, but here we go. So V1, V2. You'll notice that I've got them all pointing in the same direction too. This just makes it easier for them to stay in placement. And then V4, and we got V5. And V6. Okay, so it's important that they're all in contact there. Sometimes they can be a little bit rolly, so you might need to tape it down. But because Our patient has allowed us to just clear those spots. They all look just fine, and they're in their location. So now what I can do is you're not going to feel any discomfort here. We're just going to take that ECG. So just inform the patient that you're about to do the procedure, and if you can just relax there and try not to move, that would be great. And so we just come over to the machine and turn it on and print the ECG off, and here we go here. The paperwork, I need to make sure that we've got the patient identification sticker attached to it. I also am going to check to make sure that we've got the date and the time on the actual paperwork here. I'll also write down the reason why I've taken the ECG for the likes of, is the patient actually experiencing pain at that time? So the reason's quite important. So now what I'll do on finishing is I will remove all the leads to have the patient back so he can be comfortable again. However, what I will be doing is leaving the dots in place there, so just in case we might need to do more ECGs later, it's a good idea to leave them in that same situation, in that same positioning.